Hey folks, Caesar here from AltaView. Just going over some patient emails here, and I thought one would be interesting to share. The patient's talking about foam rolling on their iliotibial band, or the IT band. Basically asking how to do it, and like doing it properly, like that. So I figured I could take you into the clinic. I'll show you about foam rolling. A lot of people don't know how to foam roll properly or what they should even be doing when they foam roll, including a lot of physical therapists. So let's head to the clinic. I'm going to show you how to foam roll properly, and we'll get started. Come this way. So the first thing is finding the proper foam roller. So come on in here. I use this foam roller, okay, it's 3-foot one, and it's obviously cylindrical. It has about a 6-inch or so diameter, and I would say that the density is medium. Now, there's a lot of different types. There's little stubby ones, you can work with those, that's just fine. But I think that the longer one is better because it allows you at times to put 2 legs on it, whereas the little one that's just a foot won't. But there's different densities, right? So this, like I said, is medium, but there are ones that are very squishy, and they're perfectly fine. It just depends on your tolerance, your athleticism. You know, if you basically are a big muscular person, you might like the one that's hard like a rock. Some people even use a medicine ball. So I can show you that also. Essentially, we have a medicine ball over here. I want to make sure I do the proper lifting technique for you. There we go. After all, this is a physical therapy clinic. It wouldn't be smart to bend over and lift up this 12-pound ball incorrectly. So this is a medicine ball, right? Very hard, rigid, much harder than a foam roller would be. And it has one point of contact against your body because it's a sphere, right? Whereas the foam roller here, let's put this up here. Good. The foam roller has a long point of contact, right? So it distributes your body weight evenly over the surface. And there are also different types with little bumps along them and all this. It looks something like a medieval torture device almost, right? It's kind of a marketing gimmick, really. The whole idea with a foam roller is to soften the muscle, right? So when you have a muscle, there are 2 ways to soften it up, right? To gain some extensibility out of it. One is a stretch. So if I was like trying to stretch my quadriceps muscle here, I could kind of, hold like this. There you go, now you can see. Stretching the front, abdominal tuck to elongate the muscle, etc. So I'm changing the length. That's one way to soften and essentially loosen up the muscle. The second way is by applying deep pressure. So when you put pressure into a muscle, there's a nerve inside, deep inside the muscle, that senses the pressure. And if the pressure is maintained in a controlled environment where you're breathing and relaxing and allowing it to happen pain-free, then that nerve sends a reflex response. It doesn't even go through your brain. It just goes around your spinal cord, back into the muscle, and it tells the muscle, okay, let go of your tension, let go of your pain, because there's already pressure on me. There's enough pressure. I don't need to have more clenching pressure from, myself, my own muscles squeezing. So that's really what you're trying to do. It's a deep neurologic, neuromuscular response. So this whole idea of, rolling around and looks like something from, like a pizza dough. You're just rolling back and forth on it. That's ridiculous. That's more or less, you're desensitizing the area, the skin, essentially. You're basically affecting the superficial nerves along your skin and are numbing them, desensitizing it. That's what a lot of professional or even college level wrestlers do. They work on rolling around with one of these medicine balls on the ground to all different points of contact over their body, so they become comfortable, with rolling around on the floor, with people putting pressure on different regions. It's because these areas here especially are very sensitive, right? So they work on desensitizing those areas with body rolling. But I don't think that that's really what you're looking to do, because more than likely with this, especially this iliotibial band example, what you're really trying to do is relax the area, try to release the tension from the muscle. First, most important point is that the ITB is not even a muscle at all. So it's a large fascial connective tissue, right? It's sort of like a mix between ligament there and tendon, something like that. So ligaments and tendons, they don't even have muscular tissue in them to relax, right? So really, what are you doing rolling on the iliotibial band? You're just numbing down the surface of the skin, which probably makes some people feel better, I can imagine, but not really the point of releasing a muscle. The iliotibial band actually has a muscle source. It's called the TFL, or tensor fascia lata. So that is actually the muscle that you want to release to relax this area down here, right? So you always want to work on the muscle area. It's a whole different level, working on ligament and tendon, deep pressure release, etc. That's not what we're looking to do. We want the muscle release. So let's work with this here. So here's the foam roller, right? And if you want to work on the TFL area, it's basically you put your hand on your pelvic crest here, or the part of your hip that you rest on when you're kind of pouty and upset. You put your hands on your hip. That part there, that's the pelvic crest. Just below it, there's a soft, typically maybe a little uncomfortable area. That's part of the glute medius, the gluteus medius, the one that lifts your leg out to the side and helps with walking. And generally right around that area, a little in front of it, is the TFL, the tensor fascia lata. So for our purposes, you don't have to be exactly on the point, the muscle, but you have to be on the point that feels most sensitive to you. So if I were to do this here, and I'll just arrange it so you can see me well, like this, I'm gonna lie on the area like this, and I'm gonna just find that point that is sore, and I know that that's the spot, right? And there's a couple of critical criteria that I recommend. When you feel that sore spot, it should almost feel like a good soreness. A soreness where you're in control of it and it's not making you fight it and clench up. The whole idea is that you relax into the exercise, relax into the roller, and using your breathing, you sink deeper and deeper and deeper. So your breathing is really the interconnection, right, between your subconscious system, right, of how your body functions, your relaxation response, your stress response, and your controlled reaction of your nervous system, like I want to move my muscles, I want to do things, right? So it's a voluntary mechanism, right? So you can't control your heart rate, right? You can't really control your GI motility, at least immediately. And but you can control your breathing, right? So your breathing is this connection between the subconscious part of your body and the conscious. So if you can control that, you can control your level of relaxation. That's why there's whole systems out there on meditation and whatever, okay? All with the breathing. So the point is, you find that spot that's tender, and it doesn't make you feel like you're pushing off of it, because that's going to work against you. You want to work into a deeper relaxation effect. And you find the area on the side, and once you say, oh, I got it, that's the spot I want to work on, you stay there. You don't roll around the pizza dough method. That's ridiculous. You're just desensitizing. We're trying to work at the muscle level, not the skin level. Breathing in through the nose, out through the mouth, and realize where there's so much tension in your body that you don't even know until you start to relax. For example, your legs, you might be tightening up your feet, you might be holding your hips, you might be tight on your shoulder. You're supposed to be almost like a corpse. It's like dead, just laying heavy on it, right? So you find that spot, focus on your breathing, and if you're doing it right, that soreness, that tension, should slowly start to transform into just a feeling of pressure. because the roller is pushing up through you, and your pain mechanism, that soreness mechanism, actually generated from your body's muscle tension, starts to release because it feels that pressure, your breathing is letting it happen, and the reflex mechanism in your spine is signaling to the muscle, okay, just let it go, let it relax, just deal with the pressure. It's not harmful, it's just pressure. And then after a while, you'll feel, okay, I don't really even know that I'm doing anything except just laying in this position. And then you've successfully released that component of the muscle. So there might be multiple little spots where you have problems that you want to work on. So then, you could turn your position slightly, you could sit on it a little bit and get the piriformis area. You can kind of go even onto the front side some, and you could get the rectus muscle, the part of your quadriceps there. You can work on a lot of different parts. If that part is too tender, maybe you want to start on the quad muscle belly to release some of the leg tension, and you could work like this. Or what I recommend for newcomers is just do double-legged. It's a lot easier. This way is a lot more comfortable because your weight is distributed off of one leg, and now it's split between two. So let me just show you quickly the idea with the ball, which is much, there's almost a bad lift. There we go. Good. Let me show you with the ball. Same idea, much more intense. You can put it at the side if you want, like this, and boy, you'll feel immediately very, very, very strong sensations, like 10 times more than the foam roller. And you can work on that. You always have to be in control. If your breathing starts to get away from you and you find that your tension is increasing, then the soreness will follow and increase as well. So you always want to make sure you're in control with your breathing, you're relaxing, and you're just accepting the pressure on your body as it happens. And that is exactly how you release the muscle. When you stand up, you should feel that it's almost softer and lighter. If you find that you're working in different spots and it's becoming tenser, then that spot is just too hard for you, right? It's too intense. It's not your fault. It's just the way your muscles are reacting to the pain. So you can move away from it, like from the epicenter of an earthquake, right? That's the most intense point in the center. So you just start by moving out a little bit and mastering those further spots, and then you could move towards the center. Maybe you want to use something that's softer even than the foam roller. And I have here, this is one of those little sort of weighted medicine balls, these TheraBalls here. You can use this, it's a lot more comfortable to work with. Sometimes people even use a tennis ball. You can work on the side like this here. If you want to go the real cheapo method and not even buy something like this for $10, which is kind of a ridiculous price, honestly, but you can get an orange, just don't explode it on yourself, but you can use an orange or maybe a cantaloupe or whatever. I mean, there's things that you can use. If it's too squishy, like just a ball that a little kid would play with, it probably is not going to do anything. So remember, this is not a inherently complex, difficult thing to do. It's just that most people really don't understand exactly what they're supposed to be doing in order to properly foam roll. And a lot of conditions, especially very acutely painful conditions, this is not the thing to do. This is more for a chronic pain type of thing where the muscle has just been nodular, spastic, intense, and you want to try to release it. So this is not something you just injured yourself, oh, I'm going to foam roll it out like a bunch of the dummies do at the gym. That's not exactly how you're approaching this. You're approaching this from a smart method. This is a neurologic thing. You want to release the muscle. You're not concerned about rubbing back and forth and desensitizing the skin. If you have any questions about this, you can feel free to email me. Just check out the website, altaview.com. And I'll see you in the next video. Send me some questions and I'll be happy to show you in the clinic. All right, have a good day.